Another day of triple-digit COVID cases. The health department reporting 233 new cases across the state. Happy to say no new COVID-related deaths today reported. The state is currently now 59.6% fully vaccinated with more than 3,600 doses of COVID-19 vaccination administered yesterday. And good evening, everybody. Thanks for joining us on this Aloha Friday. Joe has the evening off. We begin with over 1,600 active cases. Healthcare officials now concerned that hospitals could become overwhelmed yet again. Even though there are fewer COVID patients than last year, most hospitals are already at capacity. Nikki Schenfeld explains.
With the high number of cases, hospital officials are anticipating more COVID admissions in the coming weeks. But unlike last summer's surge, there are already more non-COVID patients in the hospital who are in beds and on ventilators. 2 weeks ago, the state had 600 active cases. Today, there are over 1,600.
We are very, very concerned about the number of infections and the fact that they are staying up in that 200 plus range. There's no indication yet that the infection rates are going to go down.
During the peak of last summer's surge, there were 291 COVID patients in the hospital. But hospitals were empty of other patients who postponed surgeries. And now they're full.
So we have a record number of people in our hospitals right now.
The difference now is, life has gone on and the hospitals are busy, again, taking care of people who don't have COVID. And so now we have all these COVID cases coming in and it's really stretching, hospitals full.
Health officials say the highly contagious Delta variant is a big reason for the high case counts, plus increased travel among the unvaccinated, who are spreading it to loved ones.
Taking care of COVID patients is much harder than your average patient. They're much sicker, they require so much more technical care, and they stay a really long time.
He says typically hospital stays are 3 to 4 days.
We have COVID patients still in the hospital over 70 days right now.
He says most patients are 30 to 50 years old and unvaccinated.
And it's sad because they're, young people with jobs, families, kids, and they're super sick in the hospital now. I respect people's beliefs, but at the same time, I really wish they would consider getting vaccinated because it really does work.
We had a 23-year-old and a 32-year-old in the intensive care unit the other day. We've seen fatalities amongst people 50 and younger that get COVID and have some underlying conditions.
Nikki Schenfeld, KHON2 News, working for Hawaii.